So this is a right shoulder. The camera's coming in from the back of the shoulder looking towards the front, and we have a metal probe coming in from the front of the shoulder, and it's probing that torn labrum. Down lower, that labrum is normal on the socket. There, it's torn off. This is an instrument that's elevating the torn labrum from the socket so that we can later fix it back directly where it needs to go. Here is a rasp that rasps or roughens the edge of the socket or the bone to a nice bleeding surface. The reason we do that is when we later repair the labrum back to that bony socket, it's sitting on a nice bleeding bed of bone, and that will encourage the labrum to heal back to the bone like it should be. So that's a very sharp instrument. You can see us rasping against the edge of the bone to get it to bleed. Now this is actually how we place anchors. So through that green cannula, there's a drill sleeve, and we're putting it down on the very edge of the bone. We want to put the anchor in right at the edge of the bone because that's where we're going to secure the labrum back to the bone in its anatomical position. So we're getting the drill sleeve in the appropriate position, and then here comes the drill. And then we're going to drill what we call a pilot hole, or a little opening in the bone where we can place the anchor. And then here comes the anchor itself sliding down inside that tube. There it is, and then we're going to tap it down into that hole and secure it. The anchor has little ribs or little threads that help anchor it into the bone and hold it there. So we're tapping it all the way in, and when we have it where we like it, we'll pull out that sleeve and we'll pull out the inserter that's attached to the anchor so that the anchor is the only thing left inside the bone. Now attached to that anchor are two sutures. What we want to do is place those sutures through that labrum so that we can tie or pull a knot down and secure the labrum back to the bone. And the way that we do that is we place this curved, sharp instrument. We put that through the labrum, and we bring it out right where the labrum meets the bone. And then we feed that purple suture through the labrum, and then what we're ultimately going to do is use that purple suture to pull one of those stripe sutures back through the labrum, and that will help us anchor the labrum down. So we have our purple suture through, and then we're going to grab one of the stripe sutures, and again that's attached to the anchor. We're going to grab that purple suture, we're going to pull it out outside the shoulder, and we're going to tie those two sutures together. And when we do that, then we're able to pull on the opposite purple suture and use that to pull that stripe suture back through the labrum. And you'll see that here in a second. So right now we're tying the two sutures, one purple and one stripe together. And then we're going to pull that knot. See, that's where they're attached together. And then we're going to pull on the opposite end of the purple suture and pull that stripe suture through the labrum. There it is. And so now one limb of that stripe suture is through the labrum, and then if we want to, in a different spot, we can feed that second stripe suture through a different portion of the labrum. So in a similar way, we're going to use that curved, sharp instrument to pierce the labrum, right where the labrum meets the socket, so you can see where it's coming out, right there. And then we're going to feed that purple suture through again. And then in a similar fashion, we're going to use that purple suture to feed the second limb of that stripe suture through the labrum. See us pulling on the purple suture and pulling the stripe suture with it back through the labrum. And now in a second, we're going to have both of our stripe sutures that are attached to the anchor. Both of those sutures are going to be fed back through the labrum. Now, the final step will be to tie those two stripe sutures together and secure the labrum back to the socket. So now we're going to be tying a knot arthroscopically with instruments so that we're tying those stripe sutures together. We're going to tie it really tight so we cinch or push that labrum back onto the bone where it belongs and tie a tight knot to hold it there. So outside the shoulder through that cannula, we're tying knots, and then we're using that instrument to push that knot down through that green cannula, down right onto the labrum, and we're pushing really hard so that we can secure that labrum back to the socket with the knot. And when we're done, we use an instrument to cut the sutures right above the knot. So we just cut them. And now we're going to take an instrument and we're going to probe that labrum. We're going to see how good of a job we did. Is that labrum snugly placed back down onto the socket? So there's our probe, and we're pushing on the labrum, making sure that it's nicely snug onto the socket in the right position. Now this is a little different view. This is looking from the front of the shoulder, and we're looking right down the front of the shoulder, and that metal instrument is coming from the back of the shoulder, and we're pushing on that labrum, and see how it's nicely snug up against the socket. So that's a secure repair. You can see those knots that we previously tied that are cinching the labrum back down to the bone. And then this is a suture that we're using to close up that cannula hole, and then we're all done.